So today I'll be talking about achieving your goal, that is NEET 2021. I was getting lot of queries about discussing a strategy, a plan for those students especially who have just started or are going to start shortly, because there are so many students who have decided that they'll be preparing again. They were in the counseling procedures, and they did not wanted to compromise. They were not getting their first preferred choice, or there were so many issues. There are so many interns working as the first line warriors, or due to their personal commitments, there are so many things in the time of crisis which is going on, and now they have the time to prepare. So no problem, even now you have time, and if you have pledged that you will not waste further time, still we can be preparing well and achieving your goal, so that you are well within the range of your trajectory NEET 2021. So I have made a last 5-month strategy program for you, and if you promise me to run this way, I can promise you that you will be there. So let's start step by step. This is a step ladder approach, and we have to go step by step. So what is the step number one? The step number one: analyze your path and the strategy. If you are already preparing from January, or you are already preparing from the previous year, maybe from Central Institute examinations, then obviously you have an edge over the others. But on the other hand, you have a problem of low energy also, because by the time you reach to the last 5 or 6 months, by the time you must have completed one round of your subjects. But we also have a problem of feeling low, because we are reading day and night, and now somewhere we are lost whether we are on the right track or not. Should we change our strategy, or should we stick to this strategy? Tiredness, exhaustion, low energy, low motivational levels, low energy levels, all this is there. On the other hand, the other range of the people who are actually feeling low because they haven't started, or they have just started, and they are feeling that we have actually ran behind the race, because so many people have already started. So both these group have some pros and some cons, and the strategy will be different for both of these people. So those who had already started, they have to see that what amount of subjects they've already completed, whether they have theoretically completed or actually they are completed, actually they are able to analyze what they have studied, actually they are able to do the MCQs from this, are they satisfied with their strategy. And those who have to start have to make a new strategy. They have to actually work on how much time they have from now. If they have now pull up their socks and they are ready, all set, that come what may, now I'm going to prepare. Whatever time has been wasted, not a problem, but from now on I won't waste even a minute, even a second. So you can still do it. So what I will say, that whatever has been done, that is done, forget that, that was a past. But now you have to make a goal that you will not waste your time now, because it's now or never. If you are going to waste even the time now, then I fear you won't be able to do, because subjects are 19, course is elaborate, competition is tough. So obviously now you have to be on your toes. You have to be on your toes, so that you are within the trajectory. So for that, what you need to do, you have to make a good schedule, because if you start randomly, what happens? You are good in that subject which you have started, but when you have to prepare for PGME exam, doing very good in only one subject or some subjects will not solve your purpose. You have to be actually more than average in most of the subjects. Only then you are able to do. What we actually as students make a mistake in some of the subjects, we perform excellently well, and some of the subjects are not even touched. So I think that is not a very good idea. If you are doing good or very good in most of the subjects, that is better than performing excellently in some of the subjects and not touching even some of the subjects. So what you have to do, you have to give the time according to the weightage of the subjects. Like, this is not a secret. The PGME exam that is going to come is a NEET exam in 2021, and we already know that it will contain 300 MCQs. We already know that it will give me 3.5 hours, right? And we already know that it has got 3 sections, A, B and C. Now A is of 50 marks, B is of 100 marks and C is of 150 marks. The 50 marks, the A section consists of the basic sciences. The B section contains your pre and the paraclinical subjects, and the C consists of the clinical subjects. Now this means you can clearly see that the clinical subjects alone are more important than the pre and para. That does not mean that you need not study these subjects, but you cannot afford to compromise a clinical subject. Of course, for reading of a clinical subject, for analyzing the concepts of the clinical subjects, we require the basic sciences as well as pre and paraclinical. Now, you don't have the time of devoting too much of time, like we cannot linger on our basic sciences and the long subjects, because you have a definite time now. You do not have the excess time where if you have even spent some more time, extra time to any subject, then you can compensate in future. So that means you have to be now very, very accurate. You have to start reading the clinical subjects with the strong foundation and along with the integration with the pre and paraclinical subjects also. Now, what is the strategy you can follow? Start doing the MCQs from the very first day. See, there are two ways of learning. One is that we are reading theory, and when we are completed with whole of the theory, then you go to the Q bank and start doing the MCQs based on the knowledge that you have gained from the theory. Another way which I feel is a shorter way and a smarter way. Okay, this is a smarter way of reading the theory. The another way is that you have read the most important topics or the most important points of a subject which are high yield, which are conceptual related, which is actually important for understanding the core of that subject. And then you start doing the MCQs and we start grasping some of the important things which are the tidbits from the MCQ itself. And if I feel that this particular topic is being repeated in the MCQs again and again, or it has been asked in the recent years. Now when I say the recent year exams, then I don't mean 10 years or 15 years back. It should not be more than 5 years in any case. You can even slow it down, shorten it down to 3 years. So if that question or that topic has been asked in the previous 3 years, then it will be criminal, then it will be a blunder to leave that topic. So you have to read that topic in great details, add it to your notes and keep on reading again and again. So don't just rely on your theory to give your theory. Even we can learn from the MCQs, and I think that is a smarter way of learning, because that will give you a lot of clinical skills, that will give you a lot of differential diagnosis. And as I always say, differential diagnosis is a very important way of learning the ophthalmology. We have so many DDs in ophthalmology, and if you know how to approach those DDs, the solving of clinical questions becomes very easy. Then you also learn what are the new spheres and the dimensions, how that topic can be asked. So if you have done the core of that topic and then you do the MCQs and then revert back to that theory, you will come to know how this theory can be asked in a number of ways. So you will feel that a lot of new pores have been opened, and your entire way of looking at that theory, learning from that theory will improve. That is the basic purpose of doing lot of MCQs, and I think this is the high time of learning from MCQs. So for this you have to do more and more MCQs. Try to learn some important and beautiful concepts from the MCQs itself. Don't feel ashamed that even after doing the theory I'm not able to do the MCQs. It is that way only. Like, we cannot do 100% of the questions just after reading the theory only, and that is why we need the practice of MCQs. Otherwise, why would have been practicing MCQs? We would have just grasped the theory and we would have gone directly for the paper, but actually it is not, because you know this is a art of solving MCQs. As I always say in the class, that the MCQ paper is not just the test of your theoretical knowledge, it is also the test of your practical knowledge, your art of solving the MCQs, your art of using common sense, your art of actually applying that knowledge to the MCQs, your testing of patience. Do you have patience to read the question carefully? Do you have the patience of going through all the options and then analyzing which of the following is the best answer? So there are so many things that you actually learn. So we actually can't swim without entering into the water. So even if I give you thousands of steps in a book that you have to do this, you have to do this stroke, that stroke, but you cannot swim until and unless you enter the water. So that is why I always say do more and more MCQs, and also don't do strictly the topic wise MCQs, because you know I don't like that fundamental again where they say that this is the questions of ophthalmology, then in ophthalmology it is from lens, then in lens it is from cataract, and from cataract it is of senile cataract. Now what is the fun of doing these MCQs? You already know that all these MCQs are from acquired cataract. So that is why I think for the first go it is all right when you have to actually grasp the concepts, you have to check whether you are getting most of the MCQs from this theory or not, but otherwise you should not go very strictly to the topic wise, subject wise, subtopic wise MCQs. Another important thing is follow the 80-20 principle to the core. Now this is one important principle that holds true in almost all the aspects of the life. This says that 80% of the time we are doing 20% of the work from the 20% of the fields. 80% of the time we are wearing our clothes from only 20% of the wardrobe. 80% of the time the questions are asked from the 20% of the topics. Now this is important for you. They are saying 80% of the time the questions come from the 20% of the topics. So how will you come to know what 20% of topics are they? So again, when you do the previous year MCQs, when you do the Q banks, you will get to know what is actually these 20% of the topics. Every paper, like if it's a AIMS paper, it's a JIPMER paper, it's a PGI paper, they have a definite pattern, and the examiners have a definite priority preference of particular topics. So if you do the previous 3-year paper, you will come to know what are their preferences, what are their likes, what is their trend of asking, and you'll come to know like PGI people ask more of these things, AIMS people ask more of these things, NEET people ask more of these things. And our idea is to first grasp hold of these topics, which I know will definitely give me question in AIMS or JIPMER or PGI or NEET, and mostly you will see that it is just 20 to 30%. So instead of first covering 90% or 100% and maybe leaving those topics which are more important, give more time on these topics, because you already know that the questions will definitely touch these topics. So that is very, very important. Just doing the hard work won't do. You have to do the hard work in a smarter way, because hard work sab kar rahe hain. Everybody is doing hard work. So those who will do the hard work in a smarter way, more calculated way, in a more strategic manner, in a more planned manner, will actually have an edge. So next important thing is the clinical correlations, the DDs, and how to approach clinical scenarios. Now if you see the recent trend, NEET 2020 was a glimpse of next, and they did show that now they are going to ask more and more clinical questions, something MLE kind of a pattern. So one-liner of questions, recall based questions, just data-based questions will be very, very less. So now it's the time to improve your clinical acumen. Now how to do that? So for that actually you have to do more and more practice. Clinics and clinical acumen cannot be just achieved from the books. More and more interaction from the faculty, more and more doing the MCQs, then going through the topic. You can even plan to interact with your partner. You can interact with any study partner or any your junior, senior who is ready to talk about you or preparing for the same exam, or with the faculty. We are doing so many of live sessions. We are operating so many groups for your queries. So be interactive. That is very, very important. One way teaching won't help, because there you are just listening, you are not actually speaking, and we learn from speaking. Speak out, what do you think, and am I thinking the right way or not? So you are thinking in the one mode of teaching when there is only one person speaking, but you never know that are you thinking in the right direction or not? Is your way rationalized or not? Are you justified in thinking this? How do you think then? How should you approach that? So the answer is doing more and more questions and interacting. Then strength weakness analysis. Now when you are doing more and more questions, giving more and more tests, also start giving the test. As I told you, don't just focus on the topic wise test. You have to do the random test. Now obviously when I'm saying that give the random test, you will not be prepared with all the subjects, but not a problem. Okay, don't think that first I'll cover all the 19 subjects and only then I'll go to give the grand test or the full test. See, these tests are again not only just your diagnostic tools at how much you have done, they are also your learning tools. You are learning, because you know whatever we know, we actually don't know at one point of time. When you suddenly see a question, that old information which has been stored somewhere in your neurons suddenly comes above and you are able to use it, right? So don't think that you will be able to do only all the questions only when you have done all the subjects, and don't expect too much from yourself. Even if you are preparing and going an average, but you are improving with every score, it is totally all right, not a problem. Now what you have to do from that, analyze what is your actually weakness there. The sole idea of giving the test is that analysis is very important. See, we had so many toppers, we talked to so many toppers, the interviews are available to you. Why did we do such a tedious job for? This is for making you help and realize that whatever are their good points, you can grasp them, and what were their mistakes, you should not repeat them. There are two ways of learning. Either you learn from your mistakes, and that is a very long procedure, or a shorter one is that you learn from the others' mistakes. Do what they have done, that was right, and plus please don't do whatever they did and that was not correct. So if you see, our NEET PG 1 ranker, that is Shiv, he always tells that whatever he used to do wrong in GETs, he had made a notebook, he always used to write there, then he used to see what was his mistake, why did he did this mistake, was there some problem in concepts, was there some problem in recall, was there some problem in the notes, was it not there in the notes, if it is important you can note it. Then go through that topic, learn that topic and put the tick, so that one day will come when all your weakness areas, your problem areas will be diminishing and cut to zero. So this is how actually you have to go from the test. Okay, don't expect 300 marks from the GT, but try to improve in every GT, so that when you go for the final exam, at least you are not doing mistakes in those questions which were from the volatile areas, important areas, hide areas, previously asked areas. You are at least thorough with them. So as I already told you, causes of low GT scores, you have to be very analytical and critical. Don't be analytical that I got low scores. I got so many messages every day, ma'am, we are not improving, we are feeling low, we are feeling depressed. So don't waste time in feeling depressed and low. Waste your time. Rather, you have to utilize this time in analyzing what did went wrong there, how to improve in that area. See, if it is not very clear to you, contact the respective faculty, try to clear up that topic, try to read it from the notes, see again if it is rectified or not. So don't feel low. It is a time of working. It is not the final score. This score is not giving you the PG seat. So try to improve from that score, work on that, analyze what went wrong there. Always remember, academics deteriorate slowly and slowly. So you have to run every day, even if you want to remain at the same position. Nobody can learn anything immortally for every year without revising. So slowly and gradually, that is a human tendency, you will start forgetting. So your timetable should be such that before the memory vanishes off and you forget everything about that topic, we will plan a revision schedule. So the subjects should be in a cycle of revision every 7 to 10 days, so that we will not let the subject forget, right? Then learns from the others' experiences, others' mistakes. See, in your free time, listen to the interviews. I am not saying that spend hours on that, but one or two people who you feel are giving you genuine interviews, they are very genuine, they are helping, try to learn from them what went wrong with them. We have also shared the journeys. I'm not saying just always follow topper. Everybody may not be a topper, but actually learn from those people who have shown immense improvement, maybe from thousands, 20,000, they have come to 200. I think their journey is commendable, and we have so many things to learn from them. And they actually tell you that what were the mistakes they did in the first year of their journey and how did they improve, and you will sometimes be able to correlate your story with theirs also. And then analyze yourself. uh, are you doing the same mistake? Are you repeating? Then don't repeat the history, okay? Try to work on these areas so that you can show that result in your first year only. Then another important thing is that read first the high yield points. Like, don't make it a point when you start revising reading cover to cover every time, because you know this is actually a preparation of convergence and you have to reach the apex. So every revision will not give you that much of time that you got in the previous time. You have to revise it as if you won't get the time for revision in future. So that is very, very important. So don't make it a practice that I'll start with A and I'll go to Z every time. When I have already read from A to Z for the first time, you have highlighted the important things, the volatile things, your forgettables. If you have prepared the notes with us, we here, like I always tell, and I think every faculty do tell, that this has been a very frequently asked question, this is a high yield concept, this is a frequently asked question, this was asked in the previous years. So we have already the notes which are prepared. If you do not have those notes, see, nothing can replace your own handwritten notes. But the second best option is that if you don't have those notes, you can take the notes from someone, or maybe they are available, and you can personalize your notes, okay? Then mark on this in your first reading. You are doing the MCQs also, you are coming to know that this is important, this is important, so that you actually know what you have to revise in the next go. Don't expect that you are going to read everything in the next go. So that is again a very, very important point. Another important thing is, don't keep on adding more and more information to your notes. Now this is again a very gross mistake that most of the students do. They first have taken the notes, or if they have prepared the notes, now whenever they are doing the Q bank or any MCQ, maybe from any platform, they keep on adding that information. And you have to understand that if you keep on adding this information, already there is so much of volume. How will you revise? It's not only that you have to add it in your notes, it should be here also, because on the day only you can take your mind there, right? And it's very difficult to keep so many informations at a time from 19 subjects. So now it is the time that you have already prepared the notes, or you have taken the already prepared notes. So be very, very selective what you are going to add in your notes, right? And this I've already told you, that do revision in such a way as if you are not going to revise it again, so that your brain knows that this is important. See, if we give this information to the brain that this is important, then actually brain responds to it and take it more. So you have seen, like, if so many files are there, and if anybody says no, okay, mine is important, then that comes pinned to the top. So you have to also befool your brain and say this is very important. See, when we say that tomorrow is exam, and then suddenly you see that you are able to learn the same definition which you were not able to learn throughout the year. So why? Because brain knows tomorrow is exam, you have to learn it. So similarly, you have to give the repeated reinforcement to your brain that look, this is important, you have to do it, you have to do it. And brain is not your master, brain is your slave. If you will tell your brain that you have to do it, brain will definitely do it. So it is in your hands whether you are listening to your brain or your brain is listening to you. So that is very, very important. So I will say, start now. It's now or never, but still there is time. Forget what has been wasted, not a problem. Even if you start now, you can do it. You will be very well within the race. Don't lose hope. And many times what happens, those people who have already started, they become rabbits, they become complacent, and the newer people with whole of enthusiasm accelerate to them. So in whatever group you are, feel privileged. If you have already started, feel privileged, I have already started, but don't be complacent and keep on working hard. If you have not yet started and you have to start now and make it a point that come what may, I will do it, I'll do it. So, and what you have to do now, you can start and plan your day in such a way that you are touching one clinical and one pre or paraclinical, because you have now lesser time, so you have to work harder. So how will you work harder? With smarter strategy. Start with a clinical subject. Suppose you are starting with the surgery, then take a related subject, which can be a short subject or a subject which is related to the basic science of that clinical subject. So maybe you can correlate surgery with a short subject orthopedics as well as a basic science anatomy. Now suppose in the beginning you feel it is getting more tough to propagate with the three subjects, you can even do it with two subjects. Okay, slowly and gradually you can actually go up with the three subjects. Okay, plus when you are doing it, you have to go in such a way that you are first doing your weaker subjects, because once you hold the grasp over your weaker subjects, actually your confidence level boost up like anything, and that will help you do those subjects easily which you already know. So well begun is half done. So and every person is individual. Maybe you think that if you do those subjects which are easy for you first, then you will feel more motivated, then go that way. Yeah, everyone is individual, is different. I cannot give one strategy for everybody, but because in the starting you have time, so even if there is one more day extra you are taking, so you can adjust it with those subjects which you know. But if suppose you have done those subjects which you know and now you are left with less time with those subjects which you don't know or which are tough for you, which are volatile, then there may be a mess. So take one easy and one difficult, or one long, one short, one clinical, one paraclinical. Now you are doctors, okay, so I can't do spoon feeding for everything, but I can show you direction. So whichever direction suits you best, you can pick. Okay, pick up your shoe, which one is fitting you. Okay, but make it a point that you study to your toes. Okay, don't waste your time, don't linger on the things. Okay, if it is taking too much of time, then jump to the other one. Okay, come back to that after some time, because sometimes you are not getting one concept and you are stuck in there wasting too much of time. Then mark that, bookmark that area, and you say that I'll come back to this, let me finish up of the other things. So that is again very important. Suppose you are reading 10 hours a day. Okay, then what you have to do, keep 5 to 6 hours for a long subject, 2 hours for a short subject, and definitely keep 2 hours for doing the MCQs. Now this depends upon you whether you want to do MCQs 2 hours at a stretch, or you can do 1 hour MCQs in the morning and 1 hour MCQs in the evening. Suppose you are going up with your live classes as well. So what you can do, the long subject you can keep as whatever you are studying in the live class, short subject that you have already done, so you can revise it quickly, and 1 hour you can do the MCQs of one subject and 1 hour you can do the MCQs. So this will keep you on toes, will tell you what is actually your grasping capacity, your speed of doing the MCQs, what about your clinical skills, your clinical approach. Okay, now you know that you have got 3.5 hours for 300 MCQs, so on an average 30 to 40 seconds for one MCQ. So you have to be very fast doing the MCQs, because you have to save time for those MCQs which you were not able to do so in the first go. So suppose you are doing some MCQs in 20 seconds, so 20 seconds you are saving, because some MCQs will even take minutes. So I will suggest you that always do it by a stopwatch. Don't give yourself indefinite time for doing the MCQ. Okay, do that, I will do these many MCQs in this much time. Watch your time, how much time you are taking, because whatever time you are taking here You will take more time in the exam because that will be a new question. Exam stress will be there, new findings, everything will be new there, tenser environment. So you have to be actually very, very careful what is the time that you are taking for doing the MCQs. And in the last, I again remind you that your handwritten notes are the best source of information for you to appear in the exam. So before signing off, this is Dr. Neha Aggarwal. I'll say believing in yourself is the first secret of success. So first believe in yourself. If you are believing in yourself, you know that you will do it. Definitely you will do it. You have to just be focused, be motivated, stay positive and keep on doing hard work. Thank you and all the best.